Hello, this is Dr. David Greene, CEO of the Arizona Pain Network, where we connect those in pain with the best pain management doctors throughout the greater Phoenix, Scottsdale metropolitan area. Today the topic is, what are the top types of knee injections? And today we're going to talk about 5 different types, okay? The first type is steroid injections. They've been done for many years, decades in fact. Another name for steroid is cortisone. And basically what we know is that with knee arthritis and knee pain, there is a significant component of inflammation. That's why naproxen works, Motrin, these anti-inflammatories by mouth. But when you're making an injection of steroid, it can also give a lot of pain relief for months at a time. And that's what's going on, is it's knocking down inflammation. Initially, these injections were done mostly for rheumatoid arthritis. What they eventually showed is they also work well for osteoarthritis. And it's really never been shown that they're deleterious to your cartilage. So they're the gold standard right now for pain relief from knee arthritis. Okay? They can be done every few months. They have over a 75 to 85% effectiveness rate. They have very low risk. They can be done as an outpatient. You don't need an x-ray machine to do it. It's fairly simple to get into the knee joint. Okay? So that's number 1. Number 2 is called Viscosupplementation, which is basically hyaluronic acid injections. Now, in your knee joint, there's fluids called synovial fluid. That's another term for the joint fluid. And the analogy is basically motor oil. You need something in there to lubricate the joint, to help it move properly, to cover the cartilage, okay, and to propel the cartilage to make more cartilage. And that's what Synvisc is, Orthovisc, Hyalgan. Those types of injections are viscosupplementation with hyaluronic acid. They looked at multiple studies, and in order to get FDA approved, they had to show that they were effective, and they are. Studies show they work for 6 to 12 months, 65% of the time, and really not one is more effective than the other. Oftentimes it's a series of injections, maybe 3 over a period of 6 weeks or whatnot. There's some now that are just one big injection of maybe 20 cc's, but that's the results that you can expect. If you're younger, you got knee pain, you want to avoid a knee replacement, they can be very helpful. Okay. The next 3 types of injections fall into what's called regenerative medicine category, and now we're talking about regenerating and repairing the actual knee damage. Okay. Now, has it been definitively shown that that's what they do? No, but we don't have large studies yet. There's some small studies looking at, for instance, platelet-rich plasma therapy, PRP therapy, and that's an injection where you take some blood from a vein, spin it down, and you inject that into the problem area, in this case, the knee. And what they've shown is that a vast majority of the time, you can get significant pain relief from arthritis, a cartilage defect, whatever the problem is. They did a recent study out of the hospital for special surgery and showed that over 80% of the time, the pain relief was tremendous. And that was just with one injection. They also looked at serial MRIs every few months, and the cartilage in the knee did not degrade, did not deteriorate in that study. So it was very helpful. PRP is now on the upswing because of studies like that for things such as knee pain, knee arthritis. The second type of regenerative medicine injection is bone marrow or fat-derived stem cell injections. And this is where you take the person's own fat or bone marrow, you process it right there, and you inject it into the problem areas such as the knee, which is a hefty concentrate of stem cells and growth factors, and it can be very helpful. Some doctors are doing it in conjunction with PRP, so you get the benefit of both. You have platelets, growth factors, stem cells. So that's on the upswing as well, because small studies are showing that those work tremendously well. The last type of injection is really the same type of thing, but it's amniotic fluid derived, and that's from the amniotic fluid of a consenting donor, where it's a C-section, otherwise they would throw it away. They'll take the amniotic fluid, they process it at an FDA-regulated lab, and then use it for injection into an area such as the knee for knee arthritis. So you have the regenerative medicine side, then you have the side with the steroid injections and the hyaluronic acid, and those are the types of knee injections that you can have. Check us out on the web at preferredpaincenter.com. We work with the best pain management doctors in the whole greater Phoenix area, and that's Arizona Pain Specialists. They are experts at knee injections, spinal injections, medication management, interventional treatments. They do it all. They have chiropractic doctors, board-certified pain doctors as well at 5 locations, accepting over 50 insurances at every location throughout the valley. Call us today at 602-507-6550. We'll get you squared away with treatment at the location closest to you. I'm Dr. David Greene with the Arizona Pain Network. Your pain stops here.